first and foremost, I want to thank everybody for coming. I know it's late in the day, but we just finished our county commission meeting. But really today is more about an education piece. We are doing a great job as a community complying. We've had several discussions with the governor's office, but more importantly, I wanted to bring this locally. So Dr. Legon is here and Mason Van Holling's here. Those are the two gentlemen. The three of us have spent so much time together. We're missing Chief Steinbeck. And to really tell the general public why mask wearing is so important, what can we do to help our businesses going forward. And also we're going to be clarifying some of the guidelines that are out there that the LEAP committee put together. So for me, I just want to reiterate that one, we're a resilient community. This is new to all of us. We've been doing this since March, technically, but really in late January, we all three started talking about staying on top of this and just ask the community for their help in how we can do this better, how we can come out of this stronger, and how can we help our businesses survive during this time. So there's a lot of great ways. Dr. Legon is going to talk about the behavior of wearing a mask. What does it do? How should you wear a mask? Because we see everybody wearing them 10 different ways, 10 different kinds of masks. So we want to ensure that everybody understands what is the best and the safest way to wear a mask. Mason is here because he, one, is the chair-elect for the Hospital Association, so he works with all of the hospitals across the state. So he can give you some real-time information on what's going on. More importantly, he leads UMC, which is the county's hospital, and we're responsible for ensuring that everybody gets some coverage. What I can tell you is in the last couple of days, we've had record-breaking testing, which is phenomenal. That means people are getting out, they're getting their tests, and that is helping us. We've been working pretty hard on our contact tracing. So Dr. Legon will tell you that we have about 75 folks that are doing contact tracing today. We have about 90 more coming and another 90 after that. The National Guard has been great to work with, but when they go away in the end of July, we already have a plan in place on what that'll look like. Enforcement. This week has been tough as far as the enforcement. So between all of the cities in the Clark County Valley, we've done about a little over 3,000 enforcement. And let me remind you what enforcement is. First, we go out, we educate people on what things they should be doing, and also what can they do to better ensure social distancing. And I say that because a lot of businesses call me and they go, oh, I can't social distance. Yeah, you can move the merchandise from the front of the store so people are getting into the store, they're walking through the store. So we've been working pretty hard in Clark County, but across the valley to ensure that. We've been working with the Gaming Control Board, we've been working with OSHA, so it's a collaboration of everybody coming together to ensure that social distancing is happening, because we know that washing our hands, social distancing, and mask lower the risk for COVID-19. So there are good ways to social distance, but there's really bad ways, and we will show you what that looks like. And I'm going to ask for folks that went to that rave, I don't know, maybe we could show the video now of what happened this weekend. As much as we're working hard to be on top of everything, the rave happened, and I want to thank Channel 3 for pointing that out to us. But that is not the way to help us move forward in this process. We've also launched a Hispanic campaign so that we can get that message out to many folks within the Hispanic community. We have worked with our younger generation. We've worked with our most vulnerable. As you heard today with the County Commission, we have lots and lots of testing going on, so we encourage people to go out and to get tested. So Dr. Legon, I'm going to have you come and talk about the face coverings and the best way to wear them and the way to help all of us lower the risk.
Would you like to play the video first?
Yes. So if you want to go ahead and play the video.
Oh, he's not ready. We'll bring the doctor in.
Thank you, Commissioner. Okay, thank you. Okay, good afternoon. My name is Legon, Acting Chief Health Officer, Southern Nevada Health District. Today, I want to talk about behavioral issues regarding COVID and how can we protect our community and protect ourselves. I want to start saying that, as we know, past June 26, Governor Sisolak issued a directive requiring the use of masks in public places across Nevada. That's a very important step in the direction of protecting our community, because the use of face covering and facial masks are very important to decrease the transmission of coronavirus in the community. The need for this measure, in addition to enhancing social distancing, are two elements that each one of us can contribute and actually help decrease the transmission of COVID. The use of masks, it has been described, and there is an article that came out a few days ago in the medical literature, and actually what they do is look at the value of the use of facial masks or covering, and how it decreased the transmission of COVID. And what they discuss in that paper is that by using masks or facial covering, we are decreasing the possibility of acquiring COVID up to 5 times when compared with people who don't use a mask. The use of masks increase the value of prevention when you combine that with other measures such as social distancing, which maximize our individual ability to decrease that transmission. Yeah. I also want to say that in terms of social responsibility, it's very important that us as individuals understand the value of the mask, and also the business understand the value of asking their customers to comply with this directive from the governor's office. We have seen in recent weeks, the last 2 weeks, an increase in the number of cases locally here in Clark County. And this increase has been motivated, well, by the larger number of people, of course, interacting out there in the community, but also, unfortunately, because of our behavior. We haven't been wearing a facial covering or mask consistently as we should, and also social distancing have been a challenge in those days. Our expectation is that after this directive from the governor and our better understanding of the value of the use of facial masks, that we should start to see a decrease in transmission locally. I also want to say that a lot of people are there with a mask or some sort of tissue covering their faces, but it's important to make sure that we cover our nose and mouth, because if you are wearing the mask or facial covering and your nose is not covered, then you are not really fully protecting yourself. Also, remember that as important as it is to protect yourself, by using a facial mask, you are also protecting those around you. Whether it is the clerical staff at any office or a store where you go, or it is the person helping you at a restaurant, when you are using that mask, you are protecting that person from receiving droplets of coronavirus from you if you are infected and you don't know that. And the same thing, when this person is wearing the mask, this person is protecting you from acquiring the infection from them. In summary, I just want to emphasize that we really want everybody to comply with this directive. We want everybody to understand the value of the mask and facial covering. Also, the importance of combining this with social distancing. Even more important in those places where you are unable to fully comply with social distance because there is not enough space for that. Still, when you are wearing a mask, you are helping decrease the possibility of transmission in that area. Hand washing is important, is always important. Perhaps it's the most important preventive measure that is out there. It's something that doesn't cost anything, is easier to do, and prevent not just the transmission of coronavirus, but transmission of influenza and other viral and bacterial diseases. And again, even so, the economy is open, and now we have restaurants and multiple places out there in the community open. Still, it's important if we don't have anything essential, critical to do, it's better if you stay home and don't go to crowded places where large gatherings where you could be exposed to coronavirus or any other infections. So I want to stop here. And is Mason? Okay, Mason from UNC.
I understand that the video is ready, so we should play that now.
Well, Gerard, News 3 received a tip that a large desert rave was planned for the 4th of July, so we decided to investigate it for ourselves.
As fireworks shows happened across the valley.
So here, really what I want to show you guys is as much time as we spent and as much as we worked with the governor's office to have business licensing out, and we had investigators out all weekend. This is one event that was unlicensed, that people attended, and that was not in the best interest of so many. So for all of the good work that we were doing, one event such as this can take it all away, and it's important that folks understand that these are not sanctioned for a reason. There's absolutely no social distancing going on. They did not give permission from anybody to do it, so my phone lines are open. So if you attended that event, please, by all means, call me, because I need to find out who that promoter was, because we spent hours and hours and hours throughout our community with thousands of people doing all the right thing for just a few hundred to ruin all of that work. So I really want to point out that there are reasons why we are not sanctioning those type of events. There was no face covering, there was no social distancing, And I can't, nor can any of our business license people be looking through the deserts in the middle of the night, because we are trying to provide a safe environment in our licensed businesses that are out there, but we want to really have people stop and think about going to something like that, because it really doesn't help. And with that, I'll have Mason come up and talk about the transmission, because that's really the key to why we're all wearing face coverings.
Thank you, Chairwoman Kirkpatrick. I'm Mason Van Holling. I'm the Chief Executive Officer of University Medical Center, and just wanted to provide a few updates, what we're seeing in the hospitals, and as Chairwoman Kirkpatrick talked about the transmission rate, so I'll talk a little bit about that as well. Just a current update on how the hospitals are doing in Southern Nevada. As of last night, we've got 4,750 beds in our community. That's all the way from Mesquite to Boulder and in between. Currently, our occupancy rate is 74%. The total confirmed and suspected COVID-19 patients are about 17.7%. That number is up significantly, more than doubled since June 6th. So we are, as we're seeing the more positives go up, it is translating to hospital admissions, but not at the rate that we're seeing the positives. So I'll talk a little bit about that, but we're in our thresholds for occupancy, so we need to continue to stay diligent on the things you heard about today. ICU beds, we have 608 in our community. 84% of those are occupied. 31.4% are with COVID patients. As we opened up and businesses opened up, that number has doubled, but we've also seen other issues related to intensive care admissions. Our ventilators, we're really good there. We did a great job early on securing ventilators in this community, in our county. We have 672. 45% of those are occupied, and 33% of those that are on ventilators are COVID patients. So these are all really big benchmarks, and that the governor tracks, Chairwoman Kirkpatrick tracks, and some of the metrics for us to continue to move forward out of phase 2. Our staffing levels are green, so we're really good on our staffing. We have plenty of doctors, nurses, respiratory therapists, and staff to take care of those patients at the bedside. And our PPE is in yellow. We intentionally keep that in yellow. We want to make sure that we have enough PPE for our providers at the bedside, our visitors, and our patients. Just a little bit about the positive the testing trends that we're seeing. If you go back to April 23rd, testing was still not widespread as much as we would like, but we're in a really good place now. We were really testing symptomatic patients back then as well, so it was about a 12.2%. As you remember, the WHO said 10% was really the threshold to be able to have a safe opening in your community, and we were able to do that, get that below in the month of May. While we're working hard on that to provide testing, widespread testing to anybody that wanted a test or was symptomatic or asymptomatic, and you can see the trends when we're consistently around 7.6% positive rates on entire Nevada testing. Just a little bit about the demographics, and this has shifted over the last couple of months and more recently in the last month. The confirmed cases of COVID, initially we had a high elderly population, those that were very vulnerable, had underlying medical conditions, that 50 and higher. That's actually come down a bit, but where we've seen that significant shift, and Chairwoman just talked about where we're seeing those shifts in unauthorized gatherings in the younger population. So when you add up the 20 to 30-year-olds, it makes up 40% of our positive COVID testing. And I just want to underline to our younger population, I know that everybody's been at home and wants to get out and enjoy Las Vegas, but think about those that you love. Think about your family, your coworkers. Just because you are asymptomatic or feeling good, you can still spread the virus. And so we're seeing those trends in a younger population shifting down significantly. It's dropped about 20 years, so it's clearly in those numbers. I also do want to highlight under 10. I know that we've talked about that kids seem to do better related to this virus, but we are seeing admissions to our children's hospital, Sunrise and Summerlin, and other hospitals in the community are seeing an uptick in kids and minors with respiratory illness. We're also seeing those that are impaired from a neurological standpoint. So again, please protect your kids. They need to wear the mask, wash their hands, but also try to remove the threat of the virus in their life. Confirmed cases by gender, 52% female, 48% male. And then just from a demographics, 31% Caucasian, 41% Hispanic, and you did a great job last week, I believe it was last week, on doing a very specific campaign towards our Hispanic population with Councilwoman Diaz, and that's called It's in Your Hands, Nevada, where we're very targeted as far as providing education, resources, and testing, because as you can see, 41% of our confirmed cases are in the Hispanic population. So we're working hard on trying to bring that number down significantly. African American at 9% and Asian at 8%. We've done a lot of testing in our community. This is just really UMC's testing that I'm going to report on, but it's in line with what we're seeing with the state, about a 7.3% positive rate, and we're collecting out of all of our primary cares, our quick cares, our emergency department, the hospital, but also we are big supporters of the Thomas and Mack Convention Center and Texas Station. And I just want to talk a little bit about just the importance of wearing the mask. As you heard, it is a major contributing factor to reducing the virus. And as I mentioned earlier, this is all about reducing the threat of the virus in your life. I know we talk a lot about it, washing your hands, social distancing, wiping down surfaces, and thank you, great job in this building. But make sure you take hand sanitizers with you. We encourage businesses to have hand sanitizers. Please do that. But make sure you're wiping down surfaces frequently. Make sure you wipe your cell phone down, your computers. That is a major way of transmitting the virus as well. Just a little bit about the symptoms. When we were in front of you several months ago, we were really focused on the 100.4 temperature, the sore throat, and the aches, and the cough, but we've expanded that symptoms. So I just want to remind the community that if you do have a cough, a headache, and one of the things that is one of the bigger indicators that we're seeing now is the loss of taste and smell. That seems to be right up there with the temperature. So if you know anybody that has those symptoms, please make sure you seek out medical treatment or seek out a test, whether you're symptomatic or not. And again, I just want to encourage everyone, please stay home. If you are sick, do not go into work. Do not go into any businesses that you may spread the virus, because that is a major contributor as well. So with that, Chairwoman Kirkpatrick, I'm concluded with my briefing. But again, if we want to continue to move forward, it's really all of our civic duty to continue to move our state and our county forward. So just need everybody's help, and so we can keep the hospital numbers down and we don't get at capacity where we need to go backwards into a phase one. So, yep. Okay. Yes, ma'am. How are you? Good. Sure, I'm just bringing the slides back up. So we're in our benchmarks. We're managing very well, but I'll tell you, during this time of the year, our business is typically slower. Volumes are down. We get to catch our breath during the summer before we peak into the flu season. So, I think one of the things that I would be very focused in on is the occupancy on our medical surgical beds or our total beds, because we have plans where we can shift into other areas of the hospital. So if we need to move ICU beds into a intermediate care area or a pre-op or a PACU area in the operating rooms, we could do that. So those ICU beds may shift, but each hospital, and we've worked very closely, we've done a great job in collaborating here in the South, and all the hospitals working very closely together to be able to support each other. And so we have flexibility, but every hospital has the ability to flex up about 125% beyond their licensed beds. So we would do that first, and then we would have discussions about the alternative care site, which you know is the convention center, where we can ramp up to 900 beds there as well.
And then is there an average ICU? Is there an average, I guess, before?
Yeah, I would say looking at these numbers, you know, it's kind of a mixed bag because we're not fully open too, right? We don't have the tourism that's coming in and the movement throughout the community because there's still heart attacks, strokes, auto accidents, unfortunately. But we're tracking that very closely. It's probably in line with what we see if you were looked back last year. But we're doing really good on ventilators. And that number has really kind of leveled a bit because of our progressive medical treatments that we've been able to do. And quite frankly, testing, early intervention has helped reduce some of the ICU admissions and the ventilator use. So, but these are all metrics that everybody's looking at from the top down, and we report on these daily. So, but it's kind of hard to determine because we're not fully open for business, if you will. Yeah, great question.
So we also have business licensing here today. Vince has done an amazing job. He's had the hard task of trying to help businesses do what's expected of them. So we started early on in phase 1, stay safe to stay open. That is the reason that we are still in phase 2. I myself don't feel comfortable moving to a phase 3 at this point. However, I do think if everybody complies, as we did early on in March, wears their mask, that we will see a significant change in the numbers, and we're still testing just as many, but it takes about 2 weeks. So, right, we couldn't say that, great, everybody wore them for 4th of July, we should be good to go now. So the whole course takes a minimum of 2 weeks. It's better to look at it for 3 weeks to see what that looks like. And we know as we come back into the era, I mean, if we can't go to phase 3, how do we expect everybody else to continue on with where they're headed? So I just really want to emphasize, thank the businesses that have taken the leap to get open, to put many people back to work. We've seen thousands of people go back to work, and really just don't give them a hard time for just trying to comply and ensure that your safety is at the top of their list. Now, are there some businesses out there that are bad actors? Are there some businesses out there that are cutting corners? Absolutely, but they're not helping any of us for the long term to stay open. And I want to talk a little bit about the transmission rate. So today the transmission is at 1.7. So what we see is that for every one person that is a positive or has the virus, they're giving it to 1 7/10 of another person. And imagine if that number continues to grow, that every one person could give it to 4 or 5 people, and that's where you run into trouble. That's what you're seeing in other states. We, on a local level here, we're very diligent. I mean, Mason, Dr. Legon, myself, I bet we talk a minimum of 3 hours a day, and for different varieties. And this really is something locally that we're trying to help folks navigate. Nobody has ever been through this. And it is not easy to wear a mask all day long. I attest to that. But I'm not asking anybody to do anything that I wouldn't do for the safety of the long term of our community. And as we get into the fall and we have our typical flu season again, we're already thinking that far in advance. What does that look like? How do we prepare? And so I'm pleading to the general public, and I'm asking all of you as the media to really, it's okay to wear a mask for all of these reasons that we're telling you today, because we want to stay safe. We have to learn to live with this virus. It's not going away overnight, but how do we do that and still be able to go to work every day, have our kids go to school when the time is right? How do we go visit our loved ones that are, my neighbor is 88 years old, and it is hard for me not to go and visit her every single day. I've been doing that for 27 years, but we want to get back to that. But we can't get back to that until we lower the transmission rate, for one, and that people do their part. So if you test positive, or if you're waiting on the results of a test, I'm asking you to please continue to wear your mask, stay home unless you absolutely have to go out until you get your test results. And I will tell you that we are averaging between 3 and 7 days, depending on the volume that we had. That is so much faster than other states. And that is weeks faster than when we started this. So when we first started this, don't forget, we had to send our stuff to the CDC to get it back. But we, Clark County, the UMC, and the health district invested, collaborated, worked together to ensure that we had a lot of resources that other places do not have. We're processing close to 10,000 tests a day. Wednesday and Thursday last week were very busy. We didn't do any testing Friday, Saturday, and Sunday because we have so much testing going on that at some point I have to give the employees a break too so that they can be re-energized. It's not easy standing outside in 107-degree weather giving tests. So I'm asking all of you to thank our businesses for reopening, because it is a big task. They've spent a lot of dollars in most cases trying to provide social distancing. 90% of our businesses have told their employees to go get tested, and that's a lot. So help make Vince's job easier so that we can all do our part for a very short time so we can determine what our next move is. So there's tons of misinformation out there. Social media, it's everywhere. But I'm telling you, and I continue to only follow these two. I've been following these two since January, and I'm not going anywhere without them. I can't worry about everything else that's going on and the information, but if these two, our chief health officer, who is a medical profession, and the person who runs our local hospital, we have been ahead of the game because we've been invested and we've been planning. So I will tell you, when we opened up casinos, we called around to other states to see what they were doing. And we said, oh no, we're the gold star. We got to do better. We are light years ahead of that. Some of the guidelines that we have in place, other states are not doing that, but we feel that they're in the best interest of our public health. And that's going to be most important. All of us are constituents, and we all have to continue to do our part. So Vince is here if you have any specific business licensing questions, but we will be enforcing, and it's for public health, and it's so that we can stay open. But I wouldn't go anywhere without these two on this juncture that we're all in, because we have followed each other together, and we've been able to stay safe. We've been able to open, and we'll continue to move our community forward. So any questions? No? Yeah, Shay? So I'm going to let Vince talk about the business level, but I'm going to tell you that we're doing pretty good. We're a great community. We always step up to the task. I went to 15 different places myself over the weekend, and I didn't see where people were blatantly trying to cause havoc. I didn't see where people weren't wearing their mask. But this is really just a reminder that, and to educate folks on the importance of wearing the mask for the long term. But maybe Vince can give you some insight on some of the basics, and I'll leave that for you.
Good afternoon. I'm Vince Chiano. As Chairwoman stated, I'm with the Clark County Business License. I'm the enforcement manager. As far as our visits have been going, we've been receiving a lot of compliance. I think the education's helping. More of the public patrons are starting to wear more, be more compliant, wear masks, and businesses are starting to help us enforce the directives. A lot of it's just misunderstanding as far as not knowing when to wear the mask, when to take it off, where they're allowed to use it. So a lot of it's just education. And I'll tell you, what we've been seeing, I think a lot of businesses have been implementing placing a person at the front just for education. I think that's been helping a lot. They're out there at the front greeting patrons, reminding them that they have to wear a mask. We've been seeing a lot better results with that type of activity. But like I said, every day it gets better. More and more people are wearing masks. Some of the issues that we've seen, we've done some revisits and it's been immediately corrected. So we are getting a lot of cooperation from the businesses.
Any other questions?
Sure. I mean, as far as specifics, you'd probably have to reach out to the Public Information Office for Clark County, and they'll probably be able to assist you with that. Was there anything specific, like in general, as far as what business industries we're seeing more violations, or? Right. Right. Well, we do meet regularly with our state counterparts, but as far as the state numbers that are presented, you would have to reach out to the state for that. But yeah, as far as the violations for the county, I think the majority is probably going to be retail and food establishments, just because we have more business licenses for those types of establishments.
And so I can tell you, so when we talk about,
Could you come to the microphone, please?
sorry. So here's what I'm going to tell you about the pools in general and the guidelines. And I have had this conversation with the governor, that it is not clear in his directive nor in the LEAP guidelines that I helped create when you should wear a mask. So that has been a challenge, because also you have to follow the CDC guidelines that say absolutely not should you wear a mask inside the pool. But do I believe that you should wear a mask as you're waiting in the concession line, as you're waiting for whatever you're trying to do? If you're not going from the pool to your lounge with your party that you've been around for a long time, that you know that everybody's together, you should be wearing a mask. And today, that is not clear in either. So as I had the list with the governor this morning of some areas where we could clarify some of that, then I think that it is on me to give you the names of the bad actors. But I will tell you, I get complaints all weekend long, every day. And so today I have a complaint about an ice rink. So we've already been out there. We've already said tournaments are absolutely not allowed. I don't know where you think that you read that, but that's not okay. But a food establishment, people complained at the register because it was somewhat congested. So I call them and I say, I know that you had a lot of people that were eating this weekend. Is there a better way for you to help people check out? Is it letting them pay at their table? And 99% of the businesses absolutely are just looking for ideas because they're trying to read the print, and there's always some gray areas, and that is really our job. So as soon as we find some of those bad actors, I for sure will give you the names of them because I don't want anybody to go to them. I mean, I've been working with PT's Pub, and if you've seen, they are out front, and they're also telling you don't go to the taverns that are not doing social distancing, that are not ensuring that the capacity stays where it is. So we want the good actors to shine, and we want their business to do well, and we want the bad. I'm happy to give you some of those names, but I feel it's only fair to update the guidelines first. But really, we'll show that. I'll give it to you myself. So you don't have to go through the public information office. Call me. So the more that you all help me make it a public health issue, the easier it is. But what I'll tell you, I'm very lucky because I represent a very diverse district. And once I educate people on the importance of not transmitting it to more people, once I educate them on it's a short time and it's your choice, right? I'm nervous going to the grocery stores. And you guys heard me early on complaining about the grocery stores because it was chaos everywhere. And that's not good for anybody. And we need my job, one, as the county chair, and two, as the vice chair of the health district, is to ensure that public health is a top priority. And public health is not political. I mean, I don't check zip codes. I don't check voter registration when people come into our hospitals. I don't check them when they come into the health district. I just treat them. And that's the role, and that's real leadership, right? Leadership has to address everyone. So I never let it become the conversation. I educate them on the importance and who's at stake. And, you know, in the Hispanic community alone, what I'll tell you is there are multi-generations living within that home. And so if the young teenager goes out and goes to those raves and all those different places, they've now exposed it to 5 different people in their home. And Dr. Legon and Mason will tell you that everybody's system works different. We have seen instances where 5 people had different results. One maybe was very sick, maybe there was a death, maybe somebody didn't get it at all. And so that goes back to the public health component. And so I don't let that become the argument because public health is the top priority. Look, I feel really good about getting there. We've done this before. We're super strong. We're resilient, but it is our job to educate folks, and we will work as many hours as we need to do that. 4th of July wasn't a vacation for anybody that I know. We were on the phone, Vince, at 4 o'clock on a Friday afternoon, and Mason, Dr. Legon, and I were on 4th of July checking hospitalizations. So I'm confident in the community once they understand the importance, once they understand that keeping that transmission rate very low, keeping the ICU beds low, that our community will do it. I myself wasn't happy with that 66% number. I said, prove it to me, because everywhere I went, everybody was doing their job. But now we're going to have the numbers ourselves. All of Southern Nevada, as you heard today, I asked the cities to commit to do their part to step it up. I believe we can get to 99% compliance. So with that, we're finished. And thank you guys for coming out. Last one. What? Okay, one more. I think I know the answer, but I'm going to have Dr. Legon come up because he is our chief medical officer and chief health officer on the same day.
All right, well, that counts as just one case. Yeah, I mean, we had the database, and if somebody enters there more than once, it just counts as one. Yeah. No.